So with that, I think I hit my 20-minute mark.
So we have 10 minutes for questions of Greg and Scott, and also our previous panelists, or anything at all from this afternoon, or even this morning. So Bob's going to start us off, and I'll be looking around the room here.
First of all, I want to say it's been a great day to see how much progress rightcare has made in the years that have been away. And it seems like rightcare is doing well enough that we can think of it as a long-term effort. So my question has to do with this long-term issue. When we look at coronary artery disease, at least my understanding of it is this is a very long-term process. Probably a disease that starts in childhood, graduate, then there could be a triggering of that. When we look at these evaluations of events, is there really a realistic expectation that rightcare comes into a city and then within a couple of months, then you expect these changes to occur? And if it's not, should we be thinking about what we're doing now for people who have risk factors, but for the whole population that we serve?
So, thoughts? Maybe start off with our panel, Scott, and then.
Sure. This on? No, I'll just talk loudly then. Of course not. There would not be a causal relationship. The question is, there some other association? I'll leave you to the statistician to tell you about the causal relationship and thereof and where other. Thank you. So that would be highly unusual. However, when you heard the second part about Rob presenting about the numbers he was seeing that seem to be consistent, maybe it is making some kind of effort. I don't know if I can imply causality, but there does seem to be correlation.
The other thing is that, here we are, health plan guys, physicians, and look at the studies say that what we're doing impacts 10% of somebody's health, maybe 20%, on a good day. And it really is changing communities, changing the environment, changing the decisions that people make. And I think it's from a health plan perspective, it's a very different role, and it's a much harder lift to say, how do we create parks and avoid food deserts and get people exercising and making better choices when you go out to restaurants, etc. And I think that's one of the things that we should, if we take the very long range view as opposed to looking at those that have diabetes already or have had a stroke or whatever, and get that short-term avoidance. It's that long-term avoidance that I think is probably where we really should be focusing a lot of our time.
Yeah, I would just add to that, a huge set of dots that need to be connected. I think in terms of your question, what Ray and Scott said, is what is the role of the medical care system, the medical groups, and the health plans in improving the health of their communities, where a lot of this is going to be changed in the longer run. And so one concept, as many of you know, is this concept of accountable communities for health, or accountable care communities. In California, we have 6 of them that have been funded. We didn't get the big grant, so the foundations have stepped up, and Kaiser Permanente's put in some support. San Diego is one. There's one in Sonoma, Stockton, a couple other areas in Inland Empire for 3 years, cross-sector. So it's not just sharing data, as hard as that is among medical groups and hospitals to put their data together, right? Then try sharing that with the data systems in these other areas, transportation, education, criminal justice, etc. But that is the huge lift we have to do to really begin to get these other kinds of markers. So I think one of the things that interests me is whether or not the rightcare initiative, working with the medical care side, on these 2 conditions, which are pretty prevalent, right, is sowing some seeds in which there will be a spillover effect. We haven't even begun to think of the spillover effects yet. What would it be like? Will it be somehow more robust, more mindful, more broader thinking medical groups that are better prepared to engage the other sectors in order to produce really better health in communities? So that is a huge spillover effect. I don't know how you measure that, but I think we could come up with that. And so we're kind of making the medical care system in California more fit, if you will, not only to deal with the immediate issues, but to be able to engage the other sectors as well.
One other point I wanted to bring up about that was, we talked about the primary care shortage that's coming up, and we've been hearing about that for years now, and it's still predicted to happen. But what we're kind of seeing happen before our eyes is primary care redesign, where we're starting to truly utilize folks to the highest ability of their license and not putting everything on the back of the PCP and redesigning that care. And that's only going to get accelerated as the economic stresses go forward. So I think that's a very helpful part of this also. And we're actively engaged with we expand our pharmacy program and how we support the groups, especially those that are doing high-risk contracts, because they're going to gain the benefit also. That's how we get similar payback like Kaiser does inherently in their system.
Dr. Flinn, could you elaborate on the slide that you showed on the 17% reduction in deaths related to blood pressure control in relation to Dr. Kaplan's question?
Yes, so thank you for that prompt, Abby. The effect of that, that slide is from Archimedes modeling from Kaiser, and they use that to predict what would happen if you put the high-risk group, which is those patients 55 and older who have hypertension and are not treated. And you actually do an intervention, and using the Archimedes program, they predicted a 1 in 6 reduction of major adverse cardiac events, 17% reduction. So you can see in the high-risk population a reduction in 2 years of 17% based on that modeling. Will that get you quite where you got to, where we do with rightcare and San Diego? Probably not, but it certainly helps get you in that direction.
Okay, good, yes. And state your name and where you're from.
Yes, hi, I'm Jessica from the California Department of Public Health, and I just wanted to applaud what was just stated by all of you in terms of, you know, the medical community and health plans and health systems being part of more of the upstream healthy communities and all those more challenging issues. And I wanted this group to appreciate that we are going to have a meeting of 500 high-level leaders, including each and every one of you, May 17th, 2017, here in Sacramento at the Doubletree. You'll get more information via Hattie. But we will expect you to be there because you will hear from the community and the people working to create healthier communities about sort of their sense of how to connect with each and every one of you. And we will feature the Accountable Communities for Health and some of these other issues, because I know you don't have time to kind of be the, the person understanding what's happening in the community. We're going to bring the community to you. And so we hope that you or your representatives do come to this meeting. It's mainly going to be people at your level, people that really can do more for California. And I want to also share with you in this coming time period of a lot of angst about how do we keep California healthy. I think it's even going to be more important. And we will make clear at that meeting through leadership like Shelley and others that we know you are all working in your area to reduce heart attack and stroke. And so people will be learning from you as well. If you have materials you want to share, and again, we have Alex, our cardiovascular lead, who has a lot of, and working with many of you. We're going to make it a forum to share anything you need or you want more information from groups. It's going to be terrific. So I just want to thank you, and if you have any questions about it, let Hattie know and she'll communicate.
Great, thank you for that information. So May 17th, Alan?
Hi, Alan Tripp. I think you had mentioned the spillover effect, and I wanted to amplify that a little bit. So, as myself as a researcher, one of the honors I've had is I've really got to watch and participate with a lot of medical directors over the last 6, 7 years, and watch as their data infrastructure improves, their population health platforms improves. I've worked with plans too. Now as a researcher, I'm struggling with, I have a team and we're working with the providers, trying to make sense of how do you get healthcare systems who are traditionally, they work within their own, they don't do the community domain typically, and it's a little bit daunting to say, how do we address things out there in the community? What I gotta tell you is one of the experience, when you're going through the data and you're looking at the individual areas within a community and you're looking at the overlap across the different systems, you guys actually, the medical directors, the health plan directors, you guys have some of the most appropriate skills, and you've had to learn them, and you're learning them to, I think, do this much more quickly than you're assuming, because as we start to get this, it's going to become a simple list of, say, in San Diego, it's 100 zip codes, or it's 33 areas. And you look at that, and there's going to be some unique things about that, but you guys have to deal with different clinics and different physician personalities and different other stakeholders. So anyways, I think we may experience a little bit sort of a tipping point where it's not going to take us as long to make some advances as might be.
Great. Thank you. Let's hope not. Let's hope not. So let me maybe just begin to wrap things up a bit, and just by way of summary, if that's possible, just to share with you a few observations, and you can compare them with your own. But I heard 3 or 4 things kind of cutting throughout the day. One is the importance of targeting. Okay, that is, whether you measure by the PAM, you don't need the PAM in order to target. There's other kinds of data to get at those high risk and high complex patients, although the PAM gives you a little bit more information about that. That's where I think a lot of the big payoff is going to be with those really difficult patients in terms of adherence. Second thing I heard is, of course, not new to any of us, but underscored today, teams. Okay, expanding teams, putting the pharmacists on, the role of the health coaches on, the diabetic nurse educator, a dietitian. I didn't hear much about it, but we have found, Hector and I, in some of our work, the important role that can be played by a receptionist, for example. Okay, so teams, how we build more effective teams. And third is the ability to use all the tools that are available out there, not only pharmacists on the team and the health coaches and so forth, and the medication bundles, but also something that the words weren't used, but I'll call it visual management. That is the feedback on performance to the primary care physician and their team, and they see, oh, and they are appropriately competitive, and I don't want to be in the lowest, standard deviation and so forth and so on. So we need more visual management, getting things in front of people, because professionals are inherently want to do the best they can. So I think those are 3 or 4 of the things that I heard. And yes, you can say, well, we need to run faster, jump higher. I'm not so sure. I would say run differently. Okay, jump differently, right? But that's really going to, I think, make some difference. And we'll see where we are next year in terms of all the efforts that you guys are making. So in conclusion, I want to thank, of course, Hattie and Amanda and Carla, who really centrally put all of this together with help from a lot of others. I want to thank the Sierra Health Foundation, who hosted us today. All the sponsors have been thanked, and really want to thank all of you. It was just a terrific day. And to wind up the day, now some of you are getting awards, okay? They're here, and I think the instruction is for you to come up, pick it up, go out there to get your picture taken, right? Is that right, Hattie?
We'll ask the photographers, where's the best place to get a photograph now?
So the photographs, we will figure that out. And then we have our reception, and normally, I'm told, you have the wine and cheese. It's going to be San Diego microbrews. Okay.